Finding Hope, the Road to Recovery.
Hello, welcome to Finding Hope, the Road to Recovery. My name is Jackie Carbajal. I am the Program Operations Supervisor in Primary Care. Today's topic truly embodies the work we do at Tarzana Treatment Centers, which is integrated health care. By definition, integrated health refers to the collaboration between the medical and the behavioral health providers. Joining us today to discuss those topics are Daniela Lazar, nurse practitioner. Joining us today is Daniela Lazar, who is a nurse practitioner, and Cindy Lujan, who is a long-time patient of Tarzana Treatment Centers.
Hi, Jackie. Thank you for inviting us today. So I'm Daniela Lazar. I'm a nurse practitioner working with Tarzana since 2018. And I started working in primary care, and then slowly I transitioned to inpatient detoxing. As a primary care provider, it's our job to screen the patients, and we are screening for mental health problems and substance use disorder. Once we are identifying the patients in need of mental health or addiction treatment, we start talking with them about the next step, which is the treatment, of course. At Tarzana, we link these patients with the proper department, which is outpatient treatment, medical assistant treatment, inpatient, and mental health services also. We have a lot of patients also in primary care in need of housing. So at that point, we again link them with the department that helps them with the transitional housing. Likewise happen in detox, which the patient is already coming seeking treatment for addiction, and on our initial assessment, we identify those in need of medical care. And after testing them for HIV, hepatitis C, we are able to refer them to Tarzana clinics for HIV and hepatitis C treatment. Also, again, mental health and simply primary care. And more about the actual experience, it's Cynthia here that can talk about it. She's a patient, long-time patient at Tarzana Treatment Centers, and she pretty much went through all our programs. Hi, Cynthia. Welcome. Thank you for joining us.
Hi, thank you so much, Daniela. And thank you so much, Jackie, for having me. It's an honor and a privilege to be here, absolutely. So just a little bit about my experience with Tarzana Treatment Centers. I actually have received a tremendous amount of assistance, not just through the primary care, but also with detox. I entered detox last year, June of 21, and actually it's been going on 2 years. I'm forgetting my sobriety date. Mm-hmm. Yeah, so June 3rd of 21, I entered detox. And I just have to say this, but by somebody's grace and power greater than myself, Daniela actually helped me. She encouraged me. She motivated me to get the help that I needed, and I eventually did. So from detox, I transitioned over to residential, which is you're in treatment. And I actually stayed there for a total of 117 days. By the way, I was encouraged, I was strongly suggested by the counselors, by the techs, by the cooks, by the janitors, everyone I encountered within Tarzana Treatment Centers at Central was encouraging and motivating and just gave me that hope that that I needed. I personally needed hope, and I'm hoping that whoever hears this understands that the help is available, and it's available through Tarzana Treatment Centers. Not only did I go from detox, I went to residential. I was in 117 days. I got counseling via a therapist. I also got medical help because I had, some issues with my leg, my arm. From there, I transitioned over to IOP, which is group therapy, and I was assigned a counselor, and the counselor was just amazing. Can I mention, it was one of the counselors there was pivotal in my recovery, and I actually stayed in IOP for a total of 6 months, even though I had already transitioned out of residential bridge housing, which Tarzana also provides. And that was a huge help for me because like I said, I needed help. I couldn't focus on work. I couldn't focus on life. And until I dealt with my alcoholism, my addiction, I could not face life on life's terms. I had no hope. But being that I received all the services from Tarzana Treatment Centers, I was able to be put in a safe house, which is called RBH, Residential Bridge Housing, for a total of 6 months. I was able to transition out because I was offered a job. But that's the only reason why I left early. But I stayed in contact and continued going to my groups, which I have to say was, it just saved my life. Bottom line, it saved my life. And I continued to seek services via Tarzana Treatment Centers through primary care. And I just have to say that the doctors at Tarzana Treatment Centers are awesome. You saved my life, Daniela. You really did.
Yes.
You really did.
I'm happy to be here with you, Cynthia. And I still remember when I met you first in primary care. Do you remember that I was encouraging you to come to us and to do detoxing inpatient? And due to family situation, probably due that you weren't ready, you said, I will come to start probably outpatient. And it didn't work that way. It didn't work. We tried, you tried, and I was looking at you and I knew that you want to be helped. You need help. So that's why I kept the contact with you. Do you remember I called you when you were late for appointment? And I was telling you always, when you feel ready, come, we are here. And then we were in contact with counselors, which at that point you were able to go in inpatient detoxing. And here you are doing a great job. And story like you, it's so rewarding. And even when we have a very hard day at work, and we have every day, thinking a story like you makes the difference, makes the difference and gives us that going on every day. Whatever we are doing every day, it makes the difference. It makes the difference.
You definitely.
Thank you,
Thank you. Thank you so much.
I have a question, Cynthia. Tarzana offers an array of services, correct? MAT services. For those that don't know, MAT stands for Medication Assisted Treatment. Did you ever receive any MAT services at Tarzana?
Yes, absolutely. I have to completely, I'm all for it, especially when we talk about addiction and what's going on right now and with the fentanyl addiction, and people are dying left and right, young, old, the disease doesn't care. It was pivotal in me being able to stay, because the withdrawals of opiates, heroin, it's excruciating. It's just the most humiliating, horrible feeling. And if you can, it helped me stay and get through those first couple of days so that I can continue on with my recovery. You know, I don't think, I want to say that I wouldn't have stayed, but I will tell you that I did. And the stigma of addiction and addicts taking a medicine to get them through the withdrawal, or even it takes away the urges, you know? Why not? Correct. Why not? I'm all for it. I mean, it's saving lives. It saved mine, you know. It gives people the ability to get back and be a functioning member of society, you know. I just hope one day the stigma would be gone, because it is definitely a program that works, and it works good because they're monitored. You know, they're tested.
And which, because at Tarzana we are offering, through MAT program, we are offering methadone maintenance, we are offering Vivitrol, and also Suboxone. Which medication you choose to go on it?
The Suboxone helped me. What I've noticed in the past, many years ago, I tried methadone, and it's just another way of using, my opinion. It makes you not yourself. You feel the effects. It's like you're high. I'm sorry. It's like you're under the influence, I should say. And that's just not. But the Suboxone maintenance allowed me to get through those first stages of withdrawal and then continue on and stay, because then the uncomfortability helped me and get through those first couple of weeks, in treatment. And what I've also noticed, and because I manage a sober living, the Vivitrol, I don't know, I've never tried it, but yeah, I think the Suboxone maintenance, I think is definitely saving lives, definitely.
And that's the beauty with MAT services, right? Because everybody has, every medication works differently for every patient and their lifestyle. And, that's why having such a large, so many different medications to choose from is what helps a lot of our population.
Yeah,
exactly. And I have a lot of success cases with patients on Vivitrol, and especially because the Vivitrol helps with both alcohol and opioids addiction. And yes, they are doing great. And other patients that, as in your case, you don't feel that it's working for you or it will work for you, the Suboxone is the best choice. And also, at certain point, it may become a burden, the Suboxone, the pill, to take it every day. We, at Tarzana Treatment Centers, we are offering the Suboxone injection version, which is Sublocade. And at any point that you want to transition to Sublocade, to have more freedom and to feel that you are not reminded every day about your addiction, just let us know.
Yeah. And just to go back, I have no experience with Vivitrol, so but I do have a friend that has been going on 2 years.
Wow. And
we were both in detox together, and she gets the Vivitrol shot, and it works great for her. It really does. And the Sublocade, I heard wonderful stories, because then eventually you can just stop altogether, but that's between you and your doctor.
It's not something in between you and the doctor. It's something that you, as a person, you have to decide.
Yeah. Definitely.
And you know your body better than I know, and you know how your body is answering, and you know your habits. And the other hand, some patients are telling me, no, I don't want the Sublocade because taking Suboxone every day, yes, reminds me about my addiction, but is the reminder that keeps me sober and helps me with sobriety. Some other patients think differently. They don't want to have that reminder every day. So whatever works for you, and it's your decision. And Tarzana Treatment Centers is here to support whatever decision you are making.
Tarzana, and regarding Tarzana, I have a lot of fellows that I go to meetings with and that are still in my life, that went through Tarzana Treatment Centers, and they're living proof that it works if you work it, and if you're ready to receive the services. They're all there, right there at your fingertips. They just have to be willing. And
Yes,
that's my
exactly.
hope for all, is that they become willing, because it works.
And it's not the only medication. In addiction treatment, the medication is just a part of it. Counseling, group meetings, therapist, all those together helps the patient with sobriety. And the main thing is the patient willingness. As you said, you must want to be sober. It doesn't have to be the wife that puts you on treatment. It is not the judge that forces you to go into treatment. It's you that you want to regain control of your life, and all the other services around helps you with. It's not only, there is no magic in addiction treatment. There is no magic, no medication that changes your life from during the night, no therapist or counseling, but in time working on it and being willing to change your life and to get control of your life.
Absolutely. I surrendered. It wasn't because I thought my daughter was going to come back in my life. My thought was I lost my family forever. And what I told myself was, if and when she decides she wants me in her life again, I'm going to be a sober woman. And today, my children are in my life. And they call me, and they call me mom.
That's wonderful.
And you got also trauma therapy through Tarzana Treatment Centers.
That was
right?
pivotal.
Okay, so
I got down to the causes and conditions of why I drank and used. It was, I can't even tell you, I never even knew the whys. I always wanted to know why do I keep doing this? Why do I keep doing this? And I remember my son telling me, Mom, you need to figure out why you don't love yourself enough to recover. And I can't even tell you if I did, because it's your journey. And guess what? I found out why.
That's great.
Yeah.
That's
very
great.
well. Thank you
That's
for
great.
sharing
Thank you so
your
much.
story with us. And this is what makes us proud to work for Tarzana Treatment Centers. Stories like yours of great success. Thank you so much, ladies, for
Thank
joining
you
us.
so
Thank you,
much.
Jackie, for having us.
Thank you, Daniela.
Thank you.
So next is our expert team who will discuss the services they provide beyond primary care. Thank you everyone for joining us, and stay tuned.
Finding Hope, the Road to Recovery. Today, as we see the COVID-19 pandemic start to ease and the world open back up, the opioid epidemic remains out of control. Sadly, drug overdoses now exceed vehicular accidents as the #1 cause of unintended death in the United States. More than ever, now is the time when we must renew our efforts to find solutions for those afflicted. The answer lies in a vast array of treatment options that are backed by evidence-based practices contained within an integrated healthcare model. In this series, clinicians and experts from Tarzana Treatment Centers, a Southern California nonprofit celebrating its 50th anniversary this year, will illuminate the road to recovery through interviews and presentations. Our simple message is this: that hope exists for you or someone you care about. Please join us to find out more.
Respect my choices.
Respect my body.
Respect my faith.
Respect
my vision.
my vision.
Respect my wisdom.
Respect my culture.
Respect my future.
Respect my words.
Respect my boundaries.
Respect my boundaries.
No.
No means no.
Means no.
Means no.
No means no.
Respect.
Respect me.
Nearly half of all public school children in the United States have tried drugs or alcohol by the time they're 13 years old.
A third of teens have gone to house parties where there was alcohol, pot, cocaine, ecstasy, or prescription drugs.
Over half of kids say it would be easy for them to get pot if they wanted some.
7 out of 10 teenagers have been offered an illegal drug.
Teenagers whose parents talk to them about drugs are 42% less likely to use drugs.
Get your kids the truth about drugs. drugfreeworld.org.
Welcome back, everyone. We're so happy to have you with us again. And I am Lorraine Ragosta from Tarzana Treatment Centers, and I'm an Associate Director with Program Development. And I'm joined by two of my colleagues, Jared Nielsen and Sarita Witcher, LCSW. We're going to talk a little bit about SBIRT services, or screening, brief intervention, and referrals into treatment. To talk a little bit about how that works with primary care. So Sarita, please tell us kind of what is SBIRT and what does that kind of look like? What are those services?
Yeah, so SBIRT, the acronym of it being screening, brief intervention, and referral to treatment, the program itself really just helps to build a bridge between the doctor's office, going to see your primary care provider, and other services that could be available to you to give space for and explore other parts of your life, whether it be substance use, whether it be mental health services, you know, the emotions that we process or the thoughts that we have in our daily situations. And so us as providers get to be that connection and to speak to you more about it if it's something that you're interested in.
So, you know, for both of you, what do you think makes SBIRT different? And why is it kind of important that you found like your patients' feedback?
Yeah, well, of course, one of the biggest differences is being that our program is short-term with brief intervention versus other programs that are longer, take a little more commitment. But a big difference is that we at SBIRT are able to take somebody and address any ambivalence or they may be on the fence about treatment, seeking treatment. What does it look like? How do I do it? Do I actually have a problem? And that's where we get to come in and we really get to be that bridge that bridges people coming from not knowing about treatment to getting them into treatment through education, educating them on the levels of care, addressing their ambivalence or, them just not knowing what to do. That's where we get to come in. And although they are making a big commitment, just seeking out treatment, but it's a much smaller commitment with our program to kind of get them ready for that next level of care that they need.
Kind of like the idea of like samplers in a supermarket where you get exposed to something and they're like, this is something that's, at first it was scary, I'm not sure I want it, and you're giving them that kind of taste. What does a typical session look like? And really we're talking about two types of services, one being the substance use treatment services and then the other being mental health services. So kind of help me, like if I was somebody coming in, what does a session look like?
Yeah, so when they're in there for the substance use on that side as a counselor, I take them in, I usually take them from the clinic, bring them over, introduce the program to them, and then I screen them through multiple screeners that we have for drugs, alcohol, and a little bit on the mental health side. And then once we conduct screeners and determine kind of where they're at in their substance use and their addiction, and then that's when we start to actually, through brief intervention, we start to use motivational interviewing, kind of figure out what it is they want out of treatment, kind of figure out like the positive stuff that's in them, the coping skills, and we kind of help develop more in that sense and give them more coping skills. We kind of take like what their life is right now with substance use and maybe what it is they want to get to. What does sobriety look like to them? And that's where we work on that.
So you really just look at what change would look like for them. For mental health, same. What kind of does that look like?
Yeah. So in addition to the substance use counseling part of it, mental health can also just continue to break down any stigmas or fears with seeking treatment and with maybe speaking with a therapist about things. I know some typical common thoughts we have are, I'm crazy if I do this, or if this happens, then that means I've failed in some type of way. And it really just helps to provide education and maybe explore and really acknowledging, like Jared had said through motivational interviewing, acknowledging that this change is scary. Like this process can be scary and it can be hard, but you're not in it alone. That with us and with kind of the skills that you get to learn in further treatment and maybe longer term care, you get to really find success through these changes.
So, this is a brief intervention. You keep mentioning like motivational interviewing and brief. How can that be effective? I'm sure people are like talking about like, oh, I go to the doctor, I see you for what, like 20 minutes. Afterwards, the doctor you see for like 15. How can that really be effective in getting someone into treatment, helping them understand what it looks like, both for mental health and substance use?
Yeah, for substance use, it's really effective through, like what Sarita was saying, a lot of education and educating them on substance use and addiction. And I'm having a problem.
It's okay.
Okay, now I start over.
Okay, deep breath, it's okay.
I'm trying to think of what to talk about like this.
Would you like me to start this one?
Yeah.
Okay.
I could.
Yeah.
I think we're gonna switch, so we'll take a deep breath.
Yeah.
It's okay. Okay, so what makes brief intervention effective?
Yeah. I believe one of my favorite things about brief interventions is, since we're letting an individual know that right from the start, we get to really sit down and prioritize what is most important to them with seeking treatment. We're able to focus on the present, the here and now, to maybe sort of get rid of any of those barriers to committing to treatment. We also can provide immediate skills, whether it be alternative ways of feeling our emotions or alternative ways of responding to situations that might lead to substance use, that they can walk away with even from the start. And so it kind of really is able to encourage them, let them know from the beginning that this treatment is helpful and that it does work.
On the substance use end, like you mentioned motivational interviewing, what's effective about that piece of it?
is a lot of times is because a lot of our patients that come to us, like I said before, just don't know what treatment looks like. So we're able to kind of address their direct issue, directly right from the beginning, and we get to kind of show them and introduce them to treatment and what treatment looks like, and then like through education and breaking down the stigma of treatment, and it helps them to be more comfortable with the treatment process, and it allows us to transition them into treatment to the higher level of care that they need.
So like me being someone, if I was very fearful about treatment, and that I other people around me who say, well, that's not that big of a deal, or, hey, why are you changing your life for this? Why would you go and get any sort of help of any kind? Your technique would allow me to kind of explore those fears, really feel like I was cared for. And then I didn't have to go to necessarily some treatment center. It was given like at the primary care clinic, and that would give me a great opportunity to kind of feel like I was connected.
Yes, because more or less when you come with us, we're meeting the patient where they are. Versus if they go straight into a treatment, which is awesome, but some people don't want to do that right away. So that's where we're able to just bring them in, get them ready for that.
So if you had to kind of say the benefits that you're offering with this short term, the screening, working in primary care, both for substance use screening and this brief intervention in mental health, what do you think are the most important things for these individuals that you've been working with? And let's start with Sarita.
Yeah. The most important thing maybe for individuals that, again, attend their doctor's office or whatnot, is to know that this program really just allows space for a conversation to take place, to explore maybe how substance use fits into your life overall. While there may be good things, there also might be negative things, and just be able to talk about it and build some awareness of how it fits into your daily life, and being able to offer and again provide that education that these services are available. And I think what's really great about just being able to have that one-on-one conversation, also being able to just be level with them, just be human with them, and having this conversation that these things are there.
I know on the substance use end, a lot of people don't even realize how much they're using. I use alcohol as the most common one because it's the most socially acceptable substance that individuals utilize. You go out, you have a couple of drinks with your friends, you have wine with a meal, all those kind of things. How do you have that conversation, specifically in Espert, because they're coming in and they get screened for that, right? They get screened for the amount?
Yes, well, we do a typical screener where it comes up with a number at the end that kind of lets them know where they stand on their alcohol use. But a lot of it actually comes up through that questions. It's not the answers necessary, but it's them talking about it and being open. It's us giving those patients the safe space to be able to talk about their addiction, because sometimes they've never talked about it. And it's when they talk to us about it and we discuss it, and what does addiction look like to them. If they don't think it's a problem, what would it look like if it was a problem? And then we kind of that's where kind of motivational interviewing comes in, where we kind of get to compare what it is now, what it can look like without it, and that's where it becomes beneficial.
Actually, I was going to add as well too, it can be, how we say in our world, early intervention, or it can also just kind of help provide that education on being able to remain safe with the way that we drink, right? If it's socially acceptable, having a wine at dinner is one thing. If we're having a whole bottle, if that begins to impact us, we're able to see that and then be able to just maintain safe with how we drink, and hopefully also prevent anything in the future that may become more problematic for us.
Yeah, and I'd actually like to add to that. And there's a question that I get on a lot of substance use, and mainly marijuana, is where people tell me they don't think it's a problem, and they want to know how is a problem. And that's usually when I tell them, does it affect anything? Does it affect anything in your life? Does it affect anything in your relationships? Does it affect anything in your employment? Does it affect you when you want to get up in the morning? Does it affect you? And that's where we can kind of shed a lot of light on, especially alcoholism, because it is, socially accepted. And that's where we they kind of like look, and then they'll be like, oh yeah, it does affect. And that's where they can kind of start to see that maybe they do have an alcohol problem.
So kind of this SBIRT model that connects to primary care gives the opportunity for somebody who, is in a situation where they don't think they have a problem and they didn't realize they had a problem, or they didn't have an avenue of which to like talk to somebody, where they really can be introduced to the idea that, there's nothing wrong with having this, that there are situations like you don't think it affects you. And then someone actually asks you a question, how does it affect you? And no one maybe has asked that question. And you're given that opportunity in the SBIRT model, in the screening, brief intervention, and referral to treatment, to spend the time to give that space for them to break down what I like to call the four walls of like a treatment center, or it has to come in this flavor. To say, no, actually, this is a chance to get introduced to it and kind of ease your way in, but also like not say, I'm crazy, I'm weak, I failed, someone else is forcing me to. It gives you the option, is kind of what I'm hearing from both of you.
Yeah. And it allows them to as well, because within this program, you're meeting with actual counselors, you're meeting with actual mental health therapists right from the get-go. If you have questions, we want to be able to answer those and provide any support or any maybe resources to you for questions that you may have but never had a chance to ask, or never felt comfortable asking someone. You have that space to do it with us.
I think sometimes, people get very fearful of these things, or it's culturally not appropriate to talk about it. And I think that, hearing both of you kind of say the effectiveness of it, the fact that the brief amount of time that you're given can be something that allows you to have the opportunity to get them into services. What does that kind of look like when you're kind of attempting to get them into services?
Do you want to begin?
Yeah. So majority of the time they just have a lot of questions. They're not sure how to approach it. So that's usually when we kind of just educate them on what treatment is and what treatment looks like, and letting them know that what they speak about with us is completely confidential and only shared in between us. And that's usually when I can see that's where they open up and they're like, okay, I got this stuff I want to talk about. I might have an addiction problem, but I've never been able to bring it forward. And that's, how we approach them so they can open up to us and feel safe.
Yeah, with that as well, we walk alongside of them in this referral process. So we're able to really kind of break down some of the things that may seem overwhelming, right? If it's how do we pay for the service, or if it's a lot of the different, setting up the documentation of it sort of thing. How would I even initiate a phone call to seek services? We get to do that with them, one, so that we can break down any kind of the big words that come with hospital settings or with mental health therapy settings, but they're not alone in it either. And so it can, from experience that I've noticed, just continue to make the process seem more comfortable and easier to access.
Yeah, so like a no wrong door approach, an opportunity to connect with people and walk them through it. And I think that's vital, because oftentimes the process of getting services is intimidating.
It's overwhelming.
Yeah. I have to call a bunch of numbers. They tell me I have to wait a really long time, and part of these services, the screening, the brief intervention, referral to treatment, is that they're given some of those services and they're given that that link into it, which I think, you guys could speak to the success that you've had with individuals that you've interacted with, like you see them get into treatment.
Yeah, and even just feel more excited about it or a bit more confident that they can in fact do this and that they do see the benefits from being part of this treatment.
Do you see that in the substance use piece?
Yes, and a lot of times when we have patients that I've had a few that once they see me, they didn't know what treatment looked like. They came to me, we educated them on that. And then you see them a month, 2 later, they're successfully in their outpatient program, working the program, and even receiving mental health services. That started with Esper in the beginning, and they just say thank you, and that's a big difference. And that was where our program is so important, because we were able to be that bridge into that appropriate level of care so they can have a successful, sober life.
Do you find that some people actually get what they need from your treatment? Of the Esper treatment, the services, like as in like those 6 sessions for somebody who didn't realize how much it was impacting their life, that they might really just, that was what they needed.
Well, I can speak on a few examples, or one in particular. For the individuals who maybe drinking really isn't a problem, and it's just something that they choose to do at the end of their workday, right, to relieve a little bit of stress. Through some of those brief interventions and the quick sessions, we're able to practice and apply alternative ways of relieving that stress. And then they notice not even drinking at all. And so I do find that it can be both helpful and successful for people to receive that short time, and then also those that want to go into longer care.
And I would, I know it's been so wonderful talking to you, and I'm going to end with this because I know we got some wonderful quotes from patients, especially about our Esper, but really just one of the comments from the participants was, he's just an ordinary guy that can relate to an ordinary man going through a crisis with drugs and alcohol, and he's good at it. And I think that really speaks to this. And this model is unique. And if you want to learn more about it and more information, at the end of this presentation, we'll have all sorts of contact information for Tarzana Treatment Centers. And we appreciate the ability to share all this great services. Thank you so much for joining me today.
Thank you.
Yeah,
Thank you
it was
very
my
much.
pleasure.
It was really amazing.
Brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.